So, Barbara, thank you so much for taking a few minutes to talk to me about your experience here at Goff Surgical. But for the people out there that don't know you that are watching this video, tell us a little bit about who you are and kind of what you had done and how far out you are from your surgery.
Oh, I'm Barbara Flack, and I had a right hip replacement, and It was 5 weeks ago tomorrow, so it was not even quite 5 weeks, and it's been amazing. Everybody kept saying, "Oh, you're going to do so well," and I was doubtful. I was like, compared to what? But I will have to say that probably I was a week post-op, and I didn't have pain. In fact, I never had pain. I would say it was discomfort,
Mhm.
and I felt so much better. It was just, every bit as good as they said it would be, and maybe even better.
That's amazing. What were some of the things, I'm curious, what were some of the things that before your surgery would bother you to do? Like some patients say, like just even simple walking or getting in and out of the car, things like that. What were some of the things for you that you had trouble doing without
I
pain?
did. I live here in a retirement community here, and I don't live very far from where everything's going on. So I walked always. I never, wouldn't take a bicycle or a golf cart. And when I would walk, I would be like, halfway there, and I would be limping. And so I mean that was just constant. So walking hurt, everything hurt. I danced and I was tap dancer, and so there was a kind of like a lunge move that we did in one of the dances, and that was excruciating. I could barely do that. So all that's much better.
Amazing. So what do you like to do for fun?
Well, I like to swim. I like to dance. I like to play with my grandchildren. I like to garden. So
So awesome. Now, are you? So I heard you say you're a tap dancer.
mhm.
Are you? Are you going to start tap dancing again, or what? What's your plan for that?
Well, I've already started back, just modified practices, like just kind of not doing it, all out. But I've already started dancing. I was like, you know, it's just, it was hard to hear the music and not do it. So,
That's fantastic. That's fantastic. Now, what advice would you give a patient that might be a little bit scared about having surgery?
I would say find someone, find Dr. Goff, come and see him because I knew someone who had Dr. Goff do a hip replacement many years ago, and he, I think at that time he was using this technique. But anyway, it's like night and day from what the old technique was. I used to work in surgery, and that old technique is just, I can't imagine why anybody would do that anymore when there's a choice. So
That's great. Barbara, thank you so much for
mhm,
spending time with me today. We really appreciate it
mhm.
and looking forward to hearing all about your tap dancing going forward. So, thank you so much.
Well, thank you. I really appreciate it, and it was the post-op course has been even better than I expected it might be.
Oh, good. Thank you.